Okay, so I know you're all about delivering that top-notch behavioral health care, right? But at the same time, gotta keep things running smoothly, efficiently, and let's be real, make sure the budget's looking healthy too.
It's a constant juggling act, isn't
It
it?
really is. That's actually why we're diving into this article today called Moving the Needle: How EHR Optimization Delivers Big Wins in One Project.
Catchy title.
Right. It's from Xpio Health.
Oh yeah, they really know their stuff when it comes to this.
And this article, it really breaks things down in a way that makes you realize optimizing your electronic health record system, well, that could be a total game changer.
A game changer in lots of ways, it seems like. Not just, tech stuff. It's strategic, impacting patient care, staff, even finances.
Exactly. Think of this deep dive as like a cheat sheet to getting the absolute most out of your EHR. And since patient care is at the heart of it all,
Always.
let's start there. The article really digs into how a streamlined EHR can give your clinicians more time with their patients.
Time. That's a real gift, isn't it? Just imagine, your clinicians can finish a progress note way faster because the EHR is pulling in relevant patient data automatically. More face time, deeper connections, and the care gets better, plain and simple.
I love that visual. The gift of time makes it so clear. And then there's the data itself. The article emphasizes how optimization leads to more accurate data.
Which is huge. For making those informed treatment decisions, gotta have accurate data.
They talk about things like enhanced interfaces and those intuitive prompts, the kind that guide clinicians to capture those details that might seem small, but in behavioral health, they're crucial.
Oh, absolutely. We're dealing with complex situations here, not just checkboxes. A system that's helping clinicians input good data means you're getting that full, nuanced picture of each person. Better treatment plans, better results. That's what it's all about.
It's like you're getting a clearer view of what's really going on. And this isn't just about each clinician on their own either. Optimized EHR, it can help different departments and specialists communicate better, collaborate more.
And that's so important in behavioral health. We got to have that holistic approach. A good system, make sure everyone involved, therapists, psychiatrists, case managers, everyone's got access to the same up-to-date info. No more silos. It's integrated care for the patient.
We can't forget about the staff either. Happy staff, supported staff, that's the core of providing amazing care, wouldn't you say?
100%. And that's where EHR optimization steps in again. It's got to be tailored to your team's needs. They need to feel confident using it. That's when it really works.
Well, the article talks about burnout, and it highlights how streamlining workflows and providing good training, that can empower your staff to work smarter, not harder.
Yeah, makes sense. If you're always fighting with a clunky system, frustration builds, mistakes happen, and then, yeah, burnout. But give them a system that actually helps them, train them properly, and that's empowering. Less stress, more job satisfaction.
And that positive energy, it flows right into patient care. It's really fascinating how optimizing one system can have such a ripple effect across the whole organization, isn't it?
Shows how everything's connected. And of course, we can't forget the money side of things. Behavioral health organizations got to watch that budget carefully.
This is where I was struck by the article. It presented EHR optimization as a path to financial stability, even growth.
Which makes sense, right?
Yeah.
If you can streamline billing, improve cash flow, take some of that administrative burden off your finance team, that's going to have an impact on your bottom line.
The article really made a case for that. They talked about how it lets you work smarter, not harder. And it emphasized using data to make those financial decisions, like having a financial advisor built right in.
Exactly. Automating those billing tasks. Less errors, clearer picture of your financial health, all in real time. It's a powerful tool.
And speaking of important things, data security. That's paramount, right? Especially when we're talking about this kind of sensitive information. This is another area where an optimized EHR can really shine, bring value and peace of mind, both.
For sure. It's not just about protection. It's about being compliant, too. But a well-optimized EHR can make meeting those requirements a lot easier.
Built-in compliance officer, almost. The article talked about how an optimized system can have strong security features built right in to help you stay ahead of those cyber threats that are constantly evolving.
Multi-factor authentication, automatic encryption, those are just a couple examples.
Takes the guesswork out of compliance for sure. And that frees you up to focus on what matters.
Patience, always.
Okay, so we've talked patient care, staff, finances, data security. Pretty impressive how optimizing your EHR can have such a big impact on all these different areas. What's standing out to you so far as something that could be really impactful?
That's a great question. And I think it leads right into what we haven't talked about yet.
Which is,
How EHR optimization can set you up for strategic growth.
oh, I like where this is going. The article hinted at things like telehealth and AI-assisted diagnostics. That's the future, right? That's where behavioral healthcare is headed.
You're spot on. And that's what gets me excited.
Yeah.
Because a well-optimized EHR, it's like the foundation for all that innovation.
Oh, hold on, hold on. This is where things get really interesting. We got to dive deeper into that.
Wait, let's keep going. What's got you so fired up about the future of behavioral healthcare? What possibilities are you most excited to explore?
Well, the article hinted at this potential for optimized EHRs to support, things like telehealth and AI-assisted diagnostics.
Right.
And I'm picturing this future where you could just seamlessly integrate your EHR with a telehealth platform.
Oh, yeah.
And that lets you provide care to people who are in remote areas, people
Yeah.
who might not have access otherwise.
Exactly. Expand your reach, expand your impact.
I bet that would be amazing.
It's all about having that tech infrastructure that supports what you need now, but also lets you grow and change as the field changes.
Makes sense.
Telehealth is just one example. Think about AI.
Oh, wow. Yeah.
What if your EHR could analyze patient data, flag potential issues, maybe even help with diagnoses?
That would be huge. Game changer, really.
It would be.
Especially for your clinicians. Give them that extra layer of support, more insights, so they can make the best decisions for their patients.
Think of it as a co-pilot, an AI assistant that helps clinicians see patterns they might miss, alert them to risks, maybe even suggest treatment options based on the latest research.
Wow.
That kind of support, it would be invaluable, especially in a field like this.
Absolutely. And, it's not just the clinical side of things either. The article talked about this concept of scalability.
Right, scalability.
Meaning, your optimized EHR, it can grow along with your organization. Adapt, exactly. Without needing, these major overhauls or huge investments down the line.
Scalability is so key. In behavioral health, things change all the time. You got to be able to move quickly, be ready for new opportunities.
Yeah, it's a fast-paced world.
Imagine you decide to expand your services,
Mm-hmm.
open a new location. With a scalable EHR, you can handle that growth. No need to rip and replace your whole system.
That's got to be a huge advantage.
It is. Saves money,
Yeah.
minimizes disruptions for your staff, your patients.
Keeps things running smoothly.
Exactly. It's future-proofing your technology.
Yeah.
Because, let's face it, technology is always changing. You need a system that can keep up.
It really does feel like every day there's something new.
Imagine a world where your EHR adapts to new regulations without a hitch,
Mm-hmm.
integrates with new technologies as they come out, even anticipates what your organization might need in the future. That's the power of scalability.
And that can make a real difference for your success long term.
Absolutely.
And let's not forget a commitment to innovation that's attractive, isn't it?
It is, for talent, for
Right.
sure. Clinicians, administrative staff, everyone. People want to be part of organizations that are using the best technology, the newest stuff.
Makes sense.
A modern, optimized EHR, it sends a message.
It does, yeah.
It says you're invested in your team, that you're giving them the tools they need to provide great care.
It's like a statement about your values. You're not just keeping up, you're actually leveraging technology to make things better for everyone. Patients, staff, the whole organization.
Exactly.
So if we look back, we've covered patient care, staff satisfaction, financial health, data security, and now strategic growth. It's pretty amazing how this one thing, optimizing your EHR, can have such a wide impact.
It's a holistic approach, really.
Yeah.
Using technology to reach your goals, to build a strong and successful organization. And it all starts with a simple assessment.
Okay, so what would that look like? How would someone start down this path, the EHR optimization path?
Well, the article suggests taking a close look at your system.
Mm-hmm.
Figure out where you see room for improvement. It's like a treasure hunt.
Yeah.
Within your own technology.
Okay, I like that. A treasure hunt. So
Yeah.
what kind of treasures are we looking for here? Are there any areas you'd recommend focusing on?
For sure. Streamlining certain workflows is a big one. Improving how accurately data is entered. Exploring new integrations, things that could add functionality. Those are some good places to start.
So it's about asking the right questions and being open to new possibilities.
Exactly. It's about changing your perspective a little bit.
Yeah.
Seeing your EHR not just as, a tool, but as this strategic asset.
Yeah.
Something that can help you reach your goals.
Yeah.
And remember, you don't have to do everything at once. It's all about progress, not perfection.
Yeah.
Small steps, incremental changes
Mm-hmm.
that can have a big impact over time.
I bet it's pretty empowering taking control of your technology.
It is. It's about putting yourself in the driver's seat,
Yeah.
using your EHR to help you achieve your vision for your organization.
So as we're wrapping up this part of our exploration, what's the one key takeaway you want our listeners to walk away with today?
That EHR optimization, it's not just about technology. It's a strategic move that can make a difference across your entire organization. Take a good look at your system and ask yourself, what's one specific area I could optimize to make the biggest positive impact?
Could be something simple, like streamlining a workflow, or something bigger, like exploring a new integration.
The possibilities are endless.
So as we move on, I hope you're feeling empowered, excited about what's possible.
Me too.
Yeah.
This has been a really interesting conversation. I'm curious to see what kind of positive changes you're able to make in your organization.
Well, thanks for joining us on this deep dive. Hope you've learned some things and that you're feeling, I don't know, maybe a little inspired to take a look at your own EHR and see what you can do. Until next time, keep learning, keep innovating, and keep making a difference.